Do you think the Prime Minister in any way has lost some political capital in light of this response to the virus? What missteps has Modi's government made to get India to this point?
Well, whatever his intentions, Prime Minister Modi's strict lockdown crippled the economy. And as you would have seen over the last months, it's also displaced millions of people, and it's spread the epidemic into India's vast countryside, where there's minimal health services and absolutely no financial buffer for those who've lost their jobs. Now, Modi's also facing criticism for not doing more to help the state and local level officials on the front line of the virus fight. He's basically, after lifting the lockdown, said that the states can now be and has done very little to help them either financially or otherwise. As you said, India is now the world's second largest outbreak, and it will inevitably pass the US total. And it gives us a preview of what might happen in other poor, densely populated countries.
Ruth, what has the economic damage been to this point in India?
Well, we've just seen a 23% contraction in GDP for the last quarter. You know, India's economy is really struggling, and as the virus gains pace, that's going to put a dampener on any possibility of a quick economic recovery. Now, two things are going to happen, the experts tell us. A vast number of people are going to die, and if they don't die, they're going to lose their livelihoods. And as you mentioned, that's going to be an economic and human catastrophe. It risks reversing years of rising incomes and living standards, which have helped lift millions out of grinding poverty in India. And experts tell us that the ripple effects will be felt far beyond the South Asian region. As one epidemiologist told us, no country is safe until every country is safe from this virus.
Gosh, let's talk about Singapore, Ruth. The experience was very different, and their epidemic, at least during the second wave, has been concentrated in migrant worker dormitories. What's changed there?
Well, after declaring those dormitories clear of the virus, Singapore's now seeing a resurgence of small clusters in those worker dormitories, which, as you say, had been previously cleared. But that said, new daily cases in Singapore have dwindled to just dozens. And that follows a month-long national effort to test, isolate and treat the high-risk foreign worker community. So it points to the continued difficulties faced by nations, even those with really good, comprehensive and well-funded virus responses, to curb this disease. And you also saw similar flare-ups in Japan and South Korea as well. So each country is really facing an uphill battle to really damp out these epidemics.